We are so happy to welcome one of our newest advertisers to WJOB, and that is Sam Terese. He is the president and CEO of Alverno Labs. Good morning, Sam.
Well, good morning, Verlie, and thank you for having me. I'm looking forward to telling you a little bit about Alverno and the things that we do.
Well, thank you so much. A lot of us see Alverno Labs in a lot of our health facilities these days, taking the blood work and all of the lab requirements that your doctor might have set up for you. So tell us why Alverno Labs is now the key laboratory in most health facilities.
So Alverno has actually been around for almost 20 years now, and our reach has really extended far beyond this geographic area, but all throughout the state of Indiana and into Illinois. So we're in probably about 120, 130 locations across both states. And our core mission is to provide laboratory testing. In the days of COVID, we were on the front line doing that testing, and today we're just as present as ever with many locations for patients to come and have their lab tests. We are in all of our hospitals. Not all hospitals, I should say, but many hospitals throughout both Illinois and Indiana. I would say about 36 hospitals now. So our core business is laboratory, and that's what we do across so many different technologies.
Now, I noticed that when you go to Alverno Labs, that the results come back so quickly. Mm-hmm. Why? Tell us about the facilities that are able to handle these testing and to get our results back so quickly.
Well, our primary testing facility is actually just down the road here, just off of Exit 2, just down on Indianapolis Boulevard. We're in kind of the buildings that are behind the new Starbucks and things, where you're down by Cabela's down there. And so that's our main testing facility, and we have about 55,000 square feet of testing capability in that building, and an incredible amount of automation that allows us to really speed through turnaround time and actually deliver those results back to our patients generally within the next day, if not sooner. And we operate literally nonstop, 24 hours a day, 7 days a week. No holidays, no breaks. That's the healthcare business that we're in. And we have a really dedicated team of professionals that are just so committed to patients. While you see your blood being collected in tubes and things like that, they see each one of those as a patient. And they are so dedicated and committed to meeting those turnaround time needs and getting those results back to both our patients and our physicians.
So when you talk about staff, you have the frontline employees that are out there doing the testing and sending the results in, and then you have a staff at the lab that's actually, doing the testing and making sure those results get out. Are you in the constant stage of hiring?
Oh, absolutely. From a staffing perspective across the system, we employ over 2,000 individuals that are really committed. But like everybody these days, staffing is such a challenge. So we've had to create some really unique and creative programs to find those individuals to come and work in our laboratories. And so we've tapped into many of our schools. We have programs where we're trying to reach young people to talk about STEM and kind of those more scientific career paths that they don't always get thought of. The laboratory is often a very quiet organization, I guess, in the healthcare world. It kind of lives behind the scenes. We're not necessarily at the bedside, or we're not providing that direct care. But we do know that the majority of decisions made in healthcare are based on laboratory data. And so it's kind of the silent profession that we keep working to bring to the forefront and create many ways in which we can find people. It's really a challenging market.
So in the past, and you said you've been doing this 20 years, how long have you been with the company?
So I joined the company in 2005. All told, I've been around laboratories for a little bit north of 40 years.
Wow. So, because it's so interesting that in the past, each facility had their own lab, and then they had to send the result, send the testing out to some lab somewhere, who knew where, and then you waited a week or weeks to get this back, and now it's all so condensed.
Yes.
What do you see as the future? Because you pretty much have it handled, but we
Sure.
of course are always evolving.
Yeah, so the future really in laboratory medicine, well, as we call it, has a couple of different pathways. One, it's becoming a much more scientific, or how do I phrase that, more into the detail, looking into people's genetics and genes, particularly in oncology. And so we have programs along those kinds of things. Kind of the interesting trend, kind of in terms of where it's going, and I think we learned this through COVID. Now, most people probably have a test kit in their house.
And that's what I was going to ask you about, instantaneous, because we know in the beginning, COVID, you had to wait a few days for the results, and now you get it in 15 minutes.
Right. So the future, I think, is going to be in a kind of a next generation of kinds of testing that individuals be able to do right in their house. For an example, most diabetics, for example, don't go get their blood drawn in a healthcare facility. They either stick their finger, or in today's world, they wear a little monitor, and they're able to instantaneously get that information, and they'll be able to manage their disease quite effectively. And prevent some of the long-term consequences of diabetes. So, we'll see more, I think, of that kind of testing in the home environment. We'll see more kind of things with biosensors. We all wear, kind of those exercise monitoring kinds of things.
Pacer with my Apple Watch right now.
So, I think that's going to be part of the future of healthcare. It's even quicker and more instantaneous information, particularly in the realm of chronic disease.
Right.
And I think we'll see probably not only COVID at home, but probably flu testing at home and those kinds of things as the science evolves. But it's making sure that we evolve scientifically, because we want to put those things in the hands of the actual patients. But we want to make sure we're giving them a good test, something that's going to be meaningful and give them a true result. And so there's a lot of, I think, activity around that space. The more, the esoteric, as we call it, those things that are really kind of looking at genetic makeups, those probably will still remain in the laboratory. But, it's hard to say where we'll be in the next 20 years. We didn't think we'd be here.
Things are always changing.
Yes.
So you decided that it was important to come to WJOB, the voice of the region, to advertise about Alverno Labs. Tell us why.
Well, one of the things about Alverno is we're very committed to the communities we're in. And we have a significant presence in this community. Most of our employees live in this community. And so it's critical that we connect, and that's core to what our mission is to connect communities, improve the health in those communities, whether it's by being an employer or whether it's by offering testing. And so we want to be part of this community. We're part of the Hammond community. This is our core. This is where our main organization lives. And then we're also surrounded by many facilities here in Northwest Indiana as well, and into Central Illinois, Indiana as well. And so this is what we do. This is part of who we are, to connect to the communities we're in wherever we are. So,
well, I know when I see Alverno Labs, it gives me confidence that whatever testing I'm having done, the results are going to be accurate and true. And so your name is synonymous with quality.
We've worked very hard to earn that reputation. We are one of the few labs in the country that is ISO certified here in Hammond. And so it's something.
What does that mean? Tell us what ISO certified means.
So ISO is an international standard for quality and quality processes. There's a particular standard in the laboratory world, but there's also standards in manufacturing. So you hear many companies around the world will seek and work to become ISO certified. And so we are one of, I would say, maybe 60 or 70 laboratories in the country that have earned that. And there's probably a little bit north of about 6,000 or 7,000 laboratories out there. So it's a pretty high standard in terms of requirements that we hold ourselves to. Most labs talk about being inspected, every couple of years. We are inspected every year. We spend a lot of effort in our quality systems and how we conduct our business and how we interact with our patients. Because it not only is about testing quality, it's about also how we interact with our patients when they come into our locations, our PSCs, to make sure that experience is everything it can be. I mean, the reality is nobody really wants to have their blood drawn.
Right.
Most
but you
people.
want someone to be very, empathetic to the fact that you don't like needles or what have you.
Yep. And so it extends just, it covers the entire process from the time a person walks into one of our facilities all the way through testing and even into the delivery of results, which come through a portal these days. People can go on their phones and get the results. And
you don't have to wait for that letter in the mail?
No more letters. I don't think those happen anymore. I'm beginning to wonder. But so that's kind of the standard in terms of how we look at the entire process to make sure we're meeting everybody's needs and the community's needs as well.
So as far as what you're doing over here in Hammond and the expansion of your facilities, do you have labs located in other places of that magnitude?
Not of that magnitude. So that is our number one testing facility for the entire network. So the vast majority of testing is coming into that location. It's coming 24 hours a day, 7 days a week. We have a great logistics partner that moves a lot of that work and gets it to us in a timely way. And yes, there's weather and things like that, and somehow they manage to get through. And so we have lots of things in preparation should there be challenges along those lines. But yeah, the majority of the work comes in here. In total, between our hospitals and some other testing facilities, we probably have laboratories in about 50 locations.
So if you just had to take on any given day the number of tests that would come into that facility, could you even take a wild guess?
I don't know if I can tell you the daily number, but I think on an annual basis we probably are handling about 60 to 70 million tests. Wow. So yeah, there's a lot. On any given day, I suppose you can do the math and come up with a calculation, but I just can't seem to get there today. But
well, I mean, the yearly
busy.
Amount is enough to, give you an idea of what that facility is handling on a daily basis. It's just amazing.
Yeah, and you go away from the volume piece, and you really talk about the degree of specialization and things that Alverno has done that are really have been almost first in the country, first in the world. Way back when we were talking about microbiology, we were the first with microbiology automation, first with some new technologies that, took testing that sometimes would take, days down to, I would say 4 to 5 days, took it down to 1 or 2 days. Huge improvement, potentially saved a few lives along the way. Today, some of the things we're doing in an area called digital pathology with the implementation of artificial intelligence is really cutting edge.
So does that say you do a biopsy for somebody maybe with cancer and then you're able to...
Exactly. Yes, you know the field quite well.
I just know a bunch of stuff.
So, and those are the most critical kinds of things.
Almost definitely.
Not only from a health perspective, but if you can think of the average person who has a biopsy, what happens? You wait.
Right.
And the pain of waiting. That result. So anything and everything we can do to speed that and get that answer back into a person's hand and take away that fear, or at least give them the path forward for their managing their disease. I think all of us probably know somebody who has had that experience or been affected. So really, those are the precious kinds of specimens and things we get the opportunity to do and provide great care for.
Now, what kind of relationship do you have with the pharmaceutical companies?
Not a lot at the moment, so it is a growing area, particularly as we start bringing in some of the digital pathology pieces and the genetic testing, because very often, particularly in cancer treatment, you'll want to know a certain genetic profile of the cancer you're going after, and that aligns more specifically with the right treatment. So that's a growing area for us in terms of how we develop or create tests or bring tests in that align with what a pharmaceutical provider has from a cancer treatment perspective, but mostly it's in the oncology space.
Great. So if you had a person who was needing some type of testing, and most of the facilities here in the region are utilizing Alverno Labs.
True.
So what would you say to our listeners out there to instill confidence in them, that they know when they go into one of your facilities, you're going to be treated with respect, you're going to have a clean facility, that it's going to be very efficient, and that you can, be assured that your results will be true?
I think it comes down to the reputation that we've earned, but not only with patients, with their providers. Most encounters with the laboratory start with the physician. Your physician is the one who really orders the tests. And so if they believe that they're choosing the right lab for you, then they're choosing Alverno. We just simply pride ourselves on doing that each and every day. We have a team that goes out and makes sure and looks at all of our facilities, not only from an aesthetics perspective, but taking into account things, are we protecting people's privacy appropriately? You name it, it covers an entire gamut, an entire audit process that happens throughout the system on a daily basis. It's a very small team given the size of our organization. That spend time in every one of our locations, that get reviewed and checked. Our satisfaction monitors from patients are at a individual facility level, so we know what's happening in all of our facilities. It's not to say that we don't have a momentary challenge here and there. We've had impacts from overall building problems, and so we take action, and if we have to shut down or clean something up from the building, we let the building do that before we bring patients back in. But we are pretty committed to making sure that experience, once again, is top of mind, because it's great, you can get a result back, but if everything else is miserable, you had to wait in the waiting room for an hour, or all those things that really make it unpleasant for getting something that you don't probably want to get done anyway.
Right. That affects the impact.
Yep.
So other than the number one thing, of course, wanting to get your results, having confidence in your results, the other thing that most people are concerned about is the cost. And so let's talk about that, because some people were used in the past to getting a bill for their medical treatment, and it went to their insurance. And now when you're using other secondary facilities, they're getting a separate bill sometimes, and they don't understand it. Can you just share a little bit about billing?
Yeah, billing in healthcare continues to be a challenge on many fronts. The one thing that Alverno has been able to do and has done for many years is to successfully work with the various payers, insurance parties, to make sure that we are an in-network laboratory. Having that capability enables us to process claims, make sure they get paid, and so the patients don't have to experience that alternative bill, because we're able to go through their insurance. And so we do have a process where we can kind of review and make sure what we're going to be doing is actually going to be covered. It particularly comes into play with some of the more expensive genetic testing. Those are significantly more expensive than the average test, and you want to make sure that your insurance will cover it. And so we have a way to do that review and make sure that before we do that, that it actually will be covered. And then if we do have challenges, we do have some programs in place where we'll look at individuals' ability to pay and see if we can kind of modulate the bill, I guess, as best we can. But it really comes down to making sure that you're a network, and we pride ourselves as being a network for many, many, many providers. These days, there's so many different insurance options out there. Every now and then, one will come up, and if we get one of those, we'll work with that provider to make sure we can become a network as well. But yeah, healthcare is, from a billing and a kind of expense perspective, a significant concern for just about everybody,
Right.
myself included.
Most definitely.
But a
Well,
lot of
Sam
programs.
Terese, the CEO, President of Alverno Labs, one of our newest advertisers here on WJOB, I want to thank you for coming in today, sharing with our listeners and our viewers about Alverno Labs and why they can have confidence when they go into a facility and see that it's Alverno Labs, that they're going to get the best treatment possible and hopefully the best results possible. Thank you for coming on. Any final thing you want to say to the listeners?
No, thank you for having me. I'm always a wonderful opportunity to share what we do at Alverno. And if you want to find more out about Alverno, you can always go to our website at alvernolabs.com.
Now, will that website also have hiring opportunities?
It will have a career page for people looking for that. It has access for our patient portals and things like that. So there's a wealth of information at that website. So please go ahead and log on and learn more about Alverno.
Sounds good.